How is active transportation vital for our health? Physical inactivity has become a global epidemic. It is estimated that physical inactivity cost the world around $67.5 billion in healthcare expenditure and productivity losses in 2012. This picture is not much better in Canada, where 68% of adults do not meet daily physical activity guidelines, costing the Canadian economy $6.8 billion in direct and indirect healthcare costs. One solution is by encouraging active living. It is said that every 10% increase in physical activity could decrease health costs by $150 million. The World Health Organization has identified transportation as one of the top 10 social determinants of health. What is active transportation and what does it have to do with health? Active transportation is any kind of human-powered transportation. The most common types are walking and cycling, including walking or cycling to public transit. Physical activity, such as walking or cycling, on a regular basis can improve physical, mental, and social health. The increase in physical activity helps combat the effects of sedentary lifestyles, obesity, diabetes, and cardiovascular diseases. Engaging in physical activity helps the body release endorphins, which produce a sensation of well-being. This reduces stress and anxiety and could eliminate the risk of depression. Walking and cycling could also improve social health by allowing for better social cohesion between individuals and creating opportunities for interaction. So, what can municipalities do to improve health through active transportation? Here are 3 recommendations. 1. Municipalities can sponsor and support workplace and school programs that encourage active commuting. This is cheap and easy to implement, as many individuals have apps on their phone that count their steps or measure distance traveled by bicycle. In order to maximize the health impacts, these programs should be implemented more often, be more competitive, and encourage intensity of activity. 2. Municipalities can work with transit agencies to improve walkability in the public transit network and increase reliability. Did you know daily recommended walking requirements can be met by taking public transit? This is especially true for trips that involve transfers and walking to metro stations. In order to improve this experience, pedestrian infrastructure around transit stations should be of high quality and transit should be made reliable and frequent. This way, commuters are encouraged to walk to public transit, willing to make transfers, and can meet their daily minimum walking requirements. 3. Municipalities can work with provincial health authorities to shift funding from treatment to prevention. We know that inactivity is an epidemic and a strain on the healthcare system. Funding initiatives that encourage active transportation rather than treatment could have huge payoffs. Eventually, these initiatives pay for themselves and become a more effective allocation of resources. So, now we know how active transportation can be vital to health and economic well-being in Canada. Municipalities are in a position to help combat inactivity and help Canadians get active.